Hey everyone, Dr. Krautsack here, owner of Emerald City Family Chiropractic, and today I have Rachel with me. Who's been an amazing patient in the office, right? Rachel, you came in the office a few months ago now,
Yep.
right? So why did you come in initially? Why did you seek out healthcare, chiropractic care in the first place?
Initially, I came in because I had hurt my back moving, and so I had some lower back pain. I couldn't walk very well. It was interrupting my day-to-day life. So that's what I initially came in here for. And interestingly enough, while you were working and miraculously helping me with that, because it feels a million times better, I was talking to you about a pain that I had been having in my left shoulder for the last 6 years.
Yeah.
So a little bit about that is about six years ago, I started having trouble sleeping. I had constant pain in my left shoulder. It was interfering with lifting my arm up, and I finally went to a massage therapist and worked with her for a little bit. Didn't help, went to my doctor, and she thought it was my rotator cuff, which I thought was very odd, but I went ahead and got referred over to a specialist, and he did an MRI, said wasn't really sure there was anything there, so he put me on anti-inflammatories for a year.
Okay, so how long has this been going on so far? This is like over 3 years?
6 years. Oh, up until I went.
Yeah.
It's been going on for a couple of years.
Okay, a couple of years, and then what was the next step from there?
The next step from there was a year of the anti-inflammatories, and it wasn't helping. I wasn't sleeping through the night. It was getting worse.
Wow, okay.
I definitely couldn't lift my arm up anymore. And he finally said, well, we can go ahead and do rotator cuff repair surgery. And so I got scheduled for that.
Yeah.
And that was actually 2 years ago this month is when I had that.
So you had the surgery.
I did have the surgery.
Okay.
And it was a pretty intense surgery, as people probably know. The recovery time is quite lengthy.
How long?
I had my arm strapped to my body for like 6 weeks.
Okay.
And it wasn't about probably a full year before I was able to fully use my left arm again.
Wow. Okay.
And I'm left-handed.
Okay.
So
That's frustrating. And so you did that. You probably had to do some physical therapy as well.
I did.
Right. So all this went on for another year. Is that okay?
Yes.
And then what happened?
It wasn't better.
Yeah.
There was a little bit of the shooting pain when I lifted up that was removed. He did say I had a tear in there. I don't know. I was asleep, so I'm not sure exactly what was going on. But I still was struggling sleeping. I was still struggling picking things up.
Yeah.
Anything over the head definitely hurt.
Okay. Wow.
So I was getting an adjustment and mentioned that to you.
Yeah.
And you kind of looked at me funny, like, oh, that's your clavicle, Rachel.
Yeah.
And you're like, I can adjust that.
Yeah.
And you asked me if that was okay, and I said, sure, why not? At this point, I'm already thousands of dollars into this.
Yeah.
And so you adjusted it, and it was instant relief.
Instant relief.
Instant
there you go.
relief. And
so let's just kind of rewind a little bit.
Okay.
So you went for 6 years in pain.
Yes.
Did medication therapy and anti-inflammatories, which
Yes.
are not good for you to begin with.
Right.
Wasn't working. You had surgery. Still in pain after.
Yes.
Right. And so, a lot of times, people chase pain. Right. We got to get to the cause of the problem. Right. And so, did you do anything else after that, as far as after the surgery, to try to just back to painkillers, or?
No, I just gave up.
Just gave up. So
And
you're kind of fighting through at this point.
Just realizing that I was just going to have to be in pain every single day, and it hurts every time I put a shirt on, and I just can't get a good night's sleep, period.
Wow. Okay.
So I just assumed that was my reality.
Yeah.
And after that first adjustment, I went home, and I have slept through the night every single night since.
Yes. There we go.
So it's a little emotional, actually, to be honest with you, because I went 6 years without being able to sleep through the night.
Yeah. Yeah. And it's it's really frustrating because there's so many stories that are just like yours. I had another patient recently who she had hip pain for years, and her doctor was telling it was varicose veins. It's all these other things. A few adjustments to the hip, the low back, pain's completely gone. And very, very similar, emotions coming out, because when you put in that much money and that much of your time and that much of your life, right, and you're still in pain, it's extremely frustrating.
It is.
And so, I mean, the good news is you're feeling better now,
Yes,
right?
yes.
So your back's getting better,
Yes.
healing, your
Yes.
back's healing, your shoulder's healing.
Yes.
What other benefits have you had from care in general?
Overall, my energy level has gone up,
Mhm.
and I told you last time that I'm a half an inch taller. So
A little taller too?
I'm a little
right?
taller. Yes, I just went for my annual physical, and I think that's just because of everything that you're doing for me and straightening my
Yeah.
spine out, and everything's just getting stronger. The exercises that I do every
Mhm.
day, and I've had such positive results that I've brought my kids.
Absolutely, right? So both your kids are under care
Yep.
now, right? And
Yes.
they're having results as well, right? They're
Yes.
athletes for the most part,
Yes.
right? Staying active. And so, I mean, that's what we're about. We're about building healthy families, getting people healthy, and really addressing the functional issues in their body and their health and their spine, whether that be structurally or nutritionally, right? We have to get to the cause of the problem. There's so many great drugs out there, but if you just take drugs for every little symptom you have and you never get to the cause of the problem, you're never going to get truly healthy and well, right? And you can chase pain to the end of time, but pain's just that fire alarm going off. And right, we can break the fire alarm, we can turn it off, but until you put out the fire and get yourself healthy, that's just going to keep reoccurring, right? And so if you have headaches, migraines, back pain, a lot of the stuff that Rachel was dealing with, you have any questions, comment below or give us a call. We'll put our number in the link below. Give us a call, come on in, we'll see if we can help you, right, and get you moving in the right direction. Is there anything else you wanted to say today?
Thank you.
Oh, well, thank you for being awesome. So we always give people the credit. You know, she came in, she did all her exercises, she's doing everything we asked, right? And at the end of the day, it takes time, it takes commitment to actually fix a problem versus just managing the symptoms, right? And you did everything we asked, and that's all we can ask for here. So thank you so much. Give me a hug.
Thank you.